Welcome to this masterclass on cracking the NORCET exam by mastering the WHO Surgical Safety Checklist. This video focuses on medical surgical nursing MCQs presented by Mr. Nagesh Sir. Let's start with a knowledge check. In which year was the WHO Surgical Safety Checklist officially launched as part of the Safe Surgery Saves Lives initiative? The correct answer is B, 2008. The World Health Organization introduced the checklist in 2008 as part of the second Global Patient Safety Challenge. Remembering key dates and initiatives like 2008 is crucial for exams. Next question. The WHO Surgical Safety Checklist is divided into 3 distinct phases. What are the correct names of these phases? The correct answer is C, sign in, time out, and sign out. It's important not to confuse these specific checklist phases with the general phases of perioperative nursing. At what specific moment must the sign-in phase of the checklist be completed? The correct answer is B, before the induction of anesthesia. Sign-in requires the presence of the anesthesia professional and the nursing team, while the patient is ideally awake to confirm their identity. The time-out phase is considered the most critical pause in the surgical process. When does this phase occur? The correct answer is B, before skin incision. The timeout is an active pause where the entire surgical team stops to review critical checks before the surgeon makes the cut. When is the sign-out phase of the WHO Surgical Safety Checklist performed? The correct answer is C, before the patient leaves the operating room. Sign-out ensures all final checks, like sponge and needle counts, are complete while the entire team is still present. Who is typically designated as the, quote, checklist coordinator, responsible for ensuring all boxes are verbally checked? The correct answer is C, the circulating nurse. This role is crucial for coordinating, reading items aloud, and documenting completion, giving nurses the authority to pause the procedure for safety. Which of the following checks is not performed during the sign-in phase? The correct answer is C, antibiotic administered. Prophylactic antibiotic verification happens during the timeout phase, not the sign-in phase. Sign-in focuses on patient identity and risk assessment. According to WHO guidelines, who is primarily responsible for marking the surgical site? The correct answer is C, the person performing the procedure, typically the surgeon. Site marking should be done by the professional performing the surgery, ideally while the patient is awake. During sign-in, the risk of blood loss is evaluated. For adult patients, preparation for hemorrhage is required if anticipated blood loss exceeds. The correct answer is B, 500 milliliters. If anticipating greater than 500 milliliters of blood loss in an adult, the team must ensure adequate access and have blood products readily available. For pediatric patients, what is the critical threshold for anticipated blood loss evaluated during the sign-in phase? The correct answer is C, greater than 7 milliliter per kilogram. Due to smaller circulating blood volume in children, this weight-based threshold is used to trigger necessary hemorrhage preparations. During sign-in, which essential piece of monitoring equipment must be explicitly confirmed as, quote, placed on the patient and functioning? The correct answer is C, pulse oximeter. A functioning pulse oximeter must be placed on the patient and reading accurately before anesthesia induction to prevent preventable hypoxia-related deaths. What is the very first step the team must take when initiating the timeout phase before making the incision? The correct answer is B, confirming all team members have introduced themselves by name and role. This establishes clear communication and encourages team members to speak up about safety concerns. During the timeout, the team confirms that prophylactic antibiotics were administered within what time frame prior to incision? The correct answer is B, within the last 60 minutes. This window ensures optimal antibiotic concentration at the time of incision to prevent surgical site infections. Note the exception for certain antibiotics. During timeout, who must verbally confirm the patient's identity, the surgical site, and the procedure? The correct answer is C, the surgeon, anesthesia professional, and nurse. All 3 team leads must verbally agree to provide crucial redundancy against wrong patient or wrong site surgery. Which team member is specifically responsible for reviewing sterility indicators and equipment issues during the timeout? The correct answer is B, the nursing team. The scrub nurse or circulating nurse confirms sterility and highlights equipment issues, upholding their role as guardians of the sterile field. In which phase of the checklist does the team confirm that essential imaging, such as X-rays or MRIs, is displayed in the operating room? The correct answer is B, timeout. Checking that the correct, essential imaging is displayed prevents critical errors like operating on the wrong side. During the, quote, anticipated critical events review in the timeout, what specific information does the surgeon provide? The correct answer is C, critical steps, case duration, and anticipated blood loss. This informs the entire team of the plan and necessary preparations for potential complications. When must the nurse verbally confirm that the instrument, sponge, and needle counts are correct? The correct answer is C, sign-out. Performing counts during sign-out ensures all surgical items are accounted for before the patient leaves the operating room, preventing retained surgical items. How should surgical specimens be labeled according to the WHO checklist protocol during the sign-out phase? The correct answer is B, read aloud, including patient name and specimen description. Verbal confirmation by the nurse and surgeon prevents dangerous mislabeling errors. The final step of the sign-out phase involves reviewing the key concerns for recovery and management. Who participates in this review? The rationale for the final step is to ensure the surgeon, anesthesia professional, and nurse jointly discuss postoperative concerns, such as pain management and risk of hemodynamic instability. What is checked regarding equipment during the sign-out phase? The checklist asks if there are any equipment problems to be addressed. This continuous quality improvement tool ensures faulty instruments are immediately pulled from circulation. If a patient refuses site marking, or if marking is clinically inappropriate, what is the correct action? The correct action is C, document the reason and proceed with verbal verification. In cases of valid exceptions, rely heavily on the timeout verbal verification and ensure the exception is documented.